Hey everyone, welcome back to the podcast. In today's episode, we have Ross Nakaji, who is the owner of Los Gatos Orthopedic Sports Therapy and has been a sports physical therapist for many, many years. He's got a wealth of knowledge, and in today's episode, we're going to be talking about the biggest mistakes early sports clinicians make in their careers. Ross, welcome to the show.
This is awesome. Thanks for having me. This is one of those things that are we've been talking about getting together for a while, and it's kind of happening. This is good. This is good stuff.
Yeah,
Yeah.
100%. We do this often. It's nice to be able to put it out there and be able to share some knowledge. I know you and me have some awesome conversations
Good.
pretty often.
Hmm.
But the ones that don't know you, the people that are listening to this, that haven't met you before, that haven't seen you present at CSM,
Uh,
or many faces, can you introduce yourself and just tell them a little bit about your background?
yeah, just a little bit about me. I've been a physical therapist for 27 something years like that. Graduated from University of Pacific. Also went there for undergrad and got my degree in sports medicine, athletic training. Just kind of a local guy from the Bay Area. Really didn't go very far away from school. I still work 6 miles away from where I grew up. And so, it's just been one of my things to contribute back to the field of physical therapy. My family's a little bit intertwined with physical therapy. For a lot of people that don't know that, my dad was a PT for 30 years in private practice, affiliated with Good Samaritan Hospital up here, and my wife's a pediatric physical therapist. So, it's we always joke about how incestuous it is. We're always talking about physical therapy, and it's part of our DNA. And it's a weird thing when a local orthopedic surgeon says, "Oh, well, physical therapy is synonymous with your name," and I'm like, "No." So I don't really think of it that way. I just think of it as it's been a phenomenal career. Being coming up on 31 years or something in sports medicine, physical therapy, and it goes by fast. I think that's the biggest thing you really realize is, whether you're just working, treating, getting to know new people, networking, or teaching, any of those kinds of things. The crazy thing is, you don't really realize what you do in a year, and then you look at it in 10 years, and then you look at it in decades, and you just go, holy crap, a lot of things get done. So I think just off the topic, right off looking at it, is appreciate what you do, and what you get into and what you accomplish, because there's so many times where we get so caught up in our daily lives that we really don't look back and go, wow, that was pretty cool, and look at it with some fulfillment. So yeah, just kind of let you know, yeah, I got two kids, two in college, which makes me feel pretty dang good too. A couple of really cute dogs, and they keep me busy. So yeah, thanks for having me. This is
That's
cool, man. I'm totally
that's
excited about
awesome.
this. Yeah.
That's awesome. And you mentioned the 31 years. That's special, right? And I think that's why I wanted to bring you on here and talk about these things, because one of the
Yeah.
things that I think you do really well is you have a nice perspective of the field of sports physical therapy from where it
Hmm.
was to where it is now.
Yeah.
And you've had a residency for many years.
Hmm.
You've worked for professional sports teams for many years as a consultant, San Jose
Hmm.
University, San Jose
Hmm.
Sharks.
Hmm.
You've treated professional athletes, but you also just treat just athletes in general. So
Yeah.
you have all this. You're an athletic trainer. You've been on the field. You have a foundation. There's a lot you've done, and you really spread that knowledge to everyone on the staff. But what are some of the biggest things right off the top, right? Give me two or three things that you're like, what are the biggest mistakes you see now that sports clinicians or early aspiring sports clinicians make in their career?
Yeah, I think right now, about probably the last 10 years, residency really has kind of taken off. And I definitely think that it's a great thing. It's a good thing to model the medical profession where you get additional training, after PT school, because I think we all realize we get out of school, we learn all this stuff, we just don't know how to put it together. And I think residency is a very good venue or a good direction to go for a lot of clinicians, but I don't think it's the answer for everybody. I think there's, some schools push it a little bit, some schools don't. But I think if you go into residency with this idea that I need to concentrate on something, to focus on it, to be able to dedicate that time because you may not have that time another time in your career or things like that, I think then it makes sense. But I think if people think that, oh, if I'm residency trained, it's going to get me where I want to be next. And I don't know if that always occurs. I think people really in the sports world, they they kind of want to see you work for a while. They want to get to know you. They want to trust you. So I think coming out of school, just being residency trained doesn't mean you know everything. And I think it exposes you to a lot of those things. I just don't know if I would recommend it to everybody. So I think it's very kind of people specific, if you know what I mean. And I mean, you're residency trained. What did you think coming out of school?
I was going to say I agree with you. I think early on I finished residency and I was like, oh, I'm going to achieve all these career goals.
Hmm.
I'm going to work for a professional sports team. I'm going to get all these interviews. It didn't happen that way. I started off in a great clinic right off the bat, and I learned a lot, but I realized, wow, I don't know a lot. And I'll tell you, as a resident,
Yeah.
I felt like I didn't know anything. But
Hmm.
the following 2 years after that, I learned it all.
Good.
And then I kept going from there and learning more and more because I actually knew what to look for. I
Hmm.
think more than anything, like having a dedicated residency gave me focus, and I think
Yes.
that's what most people lack is that focused mentorship, and they lack through it multiple times in their career, not
Hmm.
just the first year, or the second year, or the fifth year, or even the 10th year.
Yeah, that's
So I
true.
agree with you. It's not a straight path, but it
Yeah.
can help.
It absolutely can help. And I think, if you choose residencies wisely, I think one of the things that we looked at in our first resident and two, cohort one and two, was really people that understood private practice, or not even just private practice, but were looking for small business, entrepreneurial type thinkers, because we realize that we're not a big institution like, the Ohio State or USC, or even like where you went and things like that. And so we didn't have that same affiliation or that same cachet. We needed someone who understood there's going to be a little bit different nuances to being in private practice. The community affiliations are very, very different. Some of them are um, literally handshake deals, right? Where once you get to a bigger organization, there's all these legalities and all this other stuff. But so many of the things that we've done here are over literally 20 years of relationships within the community. And it wasn't really until Eric Maris said to me, you have, relationships at the Pop Warner level, so youth football, you've got, gymnastics and soccer and basketball, and then you've got high schools that you guys are doing athletic training at, and then you help out with colleges, and you're helping out with pro teams. So this is a residency, dude. And I was like, oh, it didn't even dawn on me until that conversation came about, and I was like, okay, let's go after it. So I think that's the thing too. We're pretty selective with our residency program because we are still very sensitive to it is a private practice. It's not just that you can have all plenty of hours of unpredictable time being out there volunteering your time and just getting to know people. But it's again, I think that's the biggest thing. Be selective. Residency isn't for everyone. So but it can also propel your career very well too. So.
Yeah, well, and I agree with you on all those fronts, right? I think residency can help, but you don't
Mhm.
have to do residency. You can make your own residency out of. I mean, these days
100%.
there's so much online continuing education. There's
Hmm.
always have these online mentorships. There's courses. There's people you
Yeah.
can call. I mean, we're at the world's disposal right now because there's so
Yes.
many options.
That is
So yeah,
absolutely
you can
true.
make that happen.
Yep.
What
That's cool.
what do you think about early career mistakes? I think for myself, there's so many mistakes I made in my career, and I haven't had as long of a career as you.
Mhm.
But how do you feel like that fits into an aspiring sports PT's journey through trying to figure out what they want to do, and what does that have taught you over time?
Yeah, I think there's been a few people I've come across that are really early in their career, and they really aspire to get into, say, like working with the Sharks, like, or at the NHL level or even Division One, and they're just not sure how to go about it, right? And so once they kind of get a little bit of that networking, they start to see it, and then they start working in it, and they finally get to that point. There's almost a little bit of this. I don't want to use the word entitlement, but it's like, well, you have that, so why can't I have that? And they forget that, hey, that person might have been there for 27 years and they've developed this relationship and this network and this body of knowledge to doing what they do, and that's how they got there. And it might not be something that happens in 27 months, right? It's just so different. And I see sometimes frustration with that, where it's like, how come I haven't been able to achieve that you have, but I want that. And it's kind of one of those things that it does take some time. It takes some work. And I think, kind of like I said earlier in the podcast, was you don't really realize what you achieve over time, right? So when you look back, you're like, holy crap, that was pretty fun, or that was brutal. I don't know if I want to go back and do that. So I think those types of things, getting that frustration of maybe not achieving what your standard or what your goal is, it's okay, because there's always going to be something else that you're going to go after. It's one of those things of, I think we're very, very good, especially high achieving people. They're very good at the I guess it's the science of achievement, right? So it's, they set a goal, they go after it, they achieve it, and then they set another one. It's like high jumpers. They set another bar and they jump and they achieve it and they keep moving on. They want to get better and better and better. I think PTs in general are very good at that. I don't think they're very good at the art of fulfillment though. And so once they hit that goal, do they really get fulfilled by it? And I think that's where people continually struggle a little bit, is like, did they really get fulfilled by achieving that goal? And then it's like, what's next? So I think if we flip that a little bit and really do things that fulfill us, I think we'd find ourselves to be a lot happier, and equate that with those goals, as opposed to just getting an achievement. And I see that sometimes even with getting the SCS or the OCS or the CSCS or things like that. They'll be like, "Well, I got it. Now what do I do with it?" And it's like, it's like, it's not the letters. It's the time you put into it. It's the people you met to learn from. It's the time studying. It's the time researching, and then culminating in the exam. And once you pass it, it's just that you've just built this better foundation for you to be better at what you do. It doesn't necessarily make you more marketable, but it does make you more valuable. And I think that's one of those things of that, making sure that you do invest in yourself and your own career, but doing it early. And I think that's one of those things that, it's a good thing when people are earlier in their career and trying to figure out what to do, what direction to go. So, but yeah, I would say that's a big one. One big mistake is just not understanding that a lot of the people that are where they are took some time to get there, and they've got to invest that time as well. So sometimes they
Yeah.
want it like that. So
I think a lot of people do. I know I did.
yeah,
I mean, and you're right. It's the journey, not the destination. Kobe
yeah,
said it best. He said
yeah,
that exact thing, right? It's the
right,
journey, not the destination. But
yeah,
you mentioned that, and it makes me think. Well, what can PTs do then, right? With those high achievers that want it now, what are some ways that they can re-strategize early on? That if they're like, okay, I'm not hitting the goal I want to hit, and I am that high achiever. You're speaking
yeah,
to me right now. What do I do, right? Like how do
yeah,
how do I continue to move forward to try to go after that? Because you mentioned relationships and you
yeah.
mentioned building those over time,
Hmm.
and I tend to agree with you. I think that's really what makes it happen. So what can aspiring sports PTs do early on if they feel like they're hitting a wall?
Yeah, I think if you're hitting a wall, go talk to people. Go talk to people that are where you want to be, or that have done what you want to do. I've heard the quote as proximity is power. And in physical therapy, we might think of that as, proximal stability and distal mobility, but the reality to that with people is, surround yourself with those people that have done or do what you want to do. Um, you know, See what they're doing, find out what their habits are, what their rituals are. What are they doing that works, and what have they done that didn't work, right? So kind of the question that you had for me earlier is just that, what kind of mistakes have people made? I do believe that that's something that we kind of don't always think about, but if you're lucky enough to just land into those types of positions where you're around some really, really smart people, take it in, you know, absorb it, take notes, sit down, write it down. I think, one of the things I've really learned, especially going from, starting as an athletic trainer and then going to PT school and becoming a PT, and then, working in both for a while and then going into private practice, is every step of the way you realize you don't know something or you aren't very good at it. And I think most people will kind of want to go away from what they aren't very good at, right? And they'll shy away from it to a certain degree. And I think you need to turn around and hit it head on. because you kind of have to embrace what your weaknesses are, help develop them, and ultimately, if you can't really develop it, then be around people that can be what you can't do, right? And I think that's one of the biggest things in business leadership management is, if you're not very good at something, you better have some people on your team that are. And I think it's the same thing in physical therapy. When I first got out of school, um, I knew I wasn't very good at treating spine, right? Cervical spine, lumbar spine, pelvic SI joint, that kind of stuff. And being an athletic trainer, you treat extremities, and that's what you're really good at, and you see it. So once you got out, it was that feeling of, geez, I need to learn this stuff. So I went through, Stanley Paris's curriculum. I went through NIOP's curriculum, and Folsom. They do a year long up there with the Norwegian system of manual therapy. I took all their courses and really immersed myself in that first few years of just learning how to treat spines. And ironically, you fast forward 20 years, and the way I started working with the Sharks was by treating someone who had a back problem, and they didn't feel comfortable with treating a spine. So they called me up and said, "Hey, you've seen patients from this doctor." Yes. Have you seen these types of diagnoses? Yes. Could we send you them? Yeah, because we have an athlete that's got that. So, it's just kind of serendipitous how that works out, because it wasn't intentional by any means, but it was one of those things that you consciously are going, okay, I'm not very good at this. I kind of suck. So I better figure out a way and at least make sense of it, and then actually put it together. And then years down the road, it pays off in being able to treat something that you maybe wanted to do, and actually get into that. I think the other thing too was a huge payoff was being around, kind of going back to that whole thing of proximity is power. I was lucky to be around some really good clinicians that really look and focus around the pelvic girdle. And so, Rob Neighbor and Richard Jackson were the two people that really, kind of got me involved in that. And if you think about it, the pelvis really is kind of where we generate force from. And, you look at it functionally, it's the hips, the pelvis, and the lumbar spine. And if there's a problem at one of them, there's probably going to be some compensation or some other types of things that are driving the human system there too. And in athletics, especially in hockey, I mean, holy crap. I mean, that is really where a lot of things kind of come from. When you start thinking about groin issues and, sports hernias and things like that, the understanding of that area and learning that and then teaching it. And so, once I worked with Rob, and, his mentor was Richard Jackson, and then Rob said I should go hang out and just volunteer and maybe pour coffee in the back of the ballroom where Richard was teaching. And I did. And a year later, I was lab assisting with them and, teaching all over the place and things like that. And so you just never know how those things work out. But they definitely come full circle, especially the longer you do something and just keep working at it. So it's
That's
cool.
awesome. Yeah, I mean, I agree with you. Investing in your career and things you're not good at is so important. And I don't think it's just clinical though, too. I
Oh
think
yeah.
clinical is a big portion, but what else do you think is important for aspiring clinicians, sports clinicians, to have to start to build from a non-clinical skill set? Because I think that also makes a big difference. You can be the best clinician in the world,
Yeah.
but that doesn't always get you the job, doesn't always get you the fulfillment of the type of patients you want to treat or the type of career you want to have. Can you speak a little bit about things you've done and what you maybe recommend for people?
That's an amazing question, because I think you're so right. There's so many other areas that we don't think about, um, especially early in your career. Um, the funny thing about that is, I'm going to tie this into some other things, but my dad, when I first got done with graduation, so this PT school, imagine this. You're, well, I had been partying the night before and barely made my graduation and all this other stuff. And so I get there, I got my cap and gown, I got my little whatever those things are, the run up there, shake the hand of the director, give her a hug, and she goes, "Whoa." I'm like, "What?" She's like, so she obviously could smell something. So once I got down, I'm all excited, PT school graduation, this is awesome. And I go over and I see my dad, of course, is a PT, shake his hand, and he gives me a hug, and then he says, "So what are you gonna do now?" And I'm like, "What are you talking about, dude? Just graduated. have a good time, and then probably in a few days start working, maybe a week or so. And he goes, okay, well, you aren't going to know shit for 5 years, so you better figure it out. And I was like, well, that's a really good way to rain on my parade. Like, what does that mean? And I think that's when you realize that you do come out of school with all these tools, all this information, you just don't know how to put it together. And so I think going into that, I think going back to this whole thing of early career, the time, and as a person, you have to be able to focus, but you also have to take care of yourself. And so if you take care of yourself by living, a solid life, working out, eating right, getting plenty of sleep, all that other stuff, and you're able to focus on something before you have a lot of distractions. And I think that's something we don't really think about. So today's student debt is crazy, right? So let alone add that onto a mortgage, right? Or a spouse and kids and dogs and all these other responsibilities that you have in life, right? You don't think of how much the life things affect your career. But if you're able to focus on that when you don't have a lot of those distractions, you're going to set yourself light years ahead of everyone else. And I think that's something that a lot of people don't really think about, especially when they come out of school. They just think, well, I just got done with school. I kind of want to take a little break because I'm a little burned out, right? Well, no, that's actually the time you should be probably pouring it on a little bit. You have time. You have time to go work out. You've got time to make sure you're doing all the other things to make sure you're healthy, and you've got time to go and learn from people and to be better at what you do. I think it just provides this just tremendous foundation for people to learn from, and then it becomes a standard of living. I'm always going to prioritize one, my health, two, my focus of what I need to take care of, and then really just do it and take action and really go after it. I think in terms of clinical side to that, I think it allows this development is when you really do it early in your career. Again, you've got all these tools, you've got all these things that you learn from PT school, all these different specialties and all this other stuff. You just got to figure out what you need and what's going to help your patient that's in front of you best. And sometimes what that comes down to is the ability to recognize things faster. And one of my mentors, George Davies, always said it that once you get to a level of mastery, you start to cluster signs and symptoms really quickly. And all of a sudden it's like, oh, I got this. Now this is where we're going to go. We're going to change up. We're doing this. So this is what we're going to do. And it's almost like that pattern recognition is accelerated. And I think that's what you really want to be able to strive for early in your career, because that also can lead the way to other parts of your life, whether it's the health side or the financial side or relationship sides and things like that. So I think it does. It really comes back down to, kind of focusing a little bit on yourself and making sure that you can get these things prioritized when you have the time to prioritize them. I think we all know, man, once you get out in the career, there's so many other things that can take up your time. And and it's easy to do the fun stuff and not do the hard stuff. So that's always one of those things that I always kind of think of, and look back on that was a really, at the time, I thought it was a harsh comment for my dad to say to me. But at the same time, like, yeah, I'm kind of glad he said that, because it set a realistic expectation of what we're going to be in for. So, yeah.
Good stuff. So what I'm hearing from you so far is proximity is power.
Yeah.
Really take care of yourself early on, and make sure that you're pouring on early and having like some direction,
Yep.
right?
Yep.
Making sure you're investing in your clinical skills, but also other skills that are going to help you move up the ranks. And then
100%.
being patient too, and being around the people that you want to be around, or learning from them that are in the positions you might not be in yet,
Yep.
but want to be one day.
100%.
So all those things I think are really good tips for people. I have one more question for you
Yeah.
to kind of round out this episode, right?
Yeah.
What are characteristics? If you were to give me two or three characteristics that you see help, really develop a sports clinician, what are those characteristics?
Wow. I think tenacity, being able to kind of roll with things, to be able to get back up, be resilient, and really understand people. because I think everyone thinks, oh, well, if you're treating athletes, they're these elite human beings and everything like that. Yeah, maybe in one area of their life, but they're still people, and they still have a nervous system. They still have emotions. They still have, a personality that you do need to be able to get along with and understand and be able to change approaches. And I think that's I guess what they call that is now soft skills or stuff like that. But really, that is a huge part of being able to thrive, with different people and things like that. So, I don't know if that really answers the question or not, but I think those are very, I always kind of think of really valuable things to understand.
Yeah, I tend to agree with you on all those. I
Yeah.
think those are what make or break, getting that next position or getting that next job,
Hmm.
because that's what people remember about you.
Yeah.
They remember how you made them feel,
Hmm.
and what you were like as a person.
Yeah.
I think that's
Absolutely.
what really separates the ones that get what they want out of their careers and that fulfillment you mentioned earlier.
Yeah.
So
Absolutely. Cool.
good stuff. This
Cool.
is this is great. This is good advice. I think
Thank you.
everyone can take something from this, and I think your stories are really where it's at. It's those stories of like explaining what you've gone through yourself, and we'll talk more at different more episodes. I definitely want to bring you back on for more because you have
Absolutely.
a wealth of knowledge that a lot of clinicians don't hear about because there's not a lot of people talking about it.
Yeah. That's true.
Especially ones that have been in the field for like what you said 31 years.
Yeah. Don't remind me, Brian.
Yeah.
Yeah. Just starts to date me, makes me feel old. It's all good though. So
No. It's a
cool.
good thing. It's a good thing. Well,
Thank you.
Ross, appreciate you coming on,
Yeah.
sharing some of your wisdom today. We'll definitely talk soon, and thank you again.
Thank you, Brian. This has been awesome, and I do look forward to being on this again. Thank you.
Good stuff.
Awesome.